Grace O'Malley, and thank you all for taking the time to be here today. My capstone is on the lack of awareness of multiple sclerosis in our society today. The big question is, what is multiple sclerosis? Is it an injury, illness, or some sort of medical condition? Multiple sclerosis is more commonly referred to as MS. MS is defined by National MS Society by Professor Tim Cotes as a disease that impacts the central nervous system, a portion of your body that controls everything you do. In MS, inflammation damages the neurons and their protective sheath on the nerve endings called myelin. On the upper left image, you can see where the nerve is in good condition, and here where the damaged nerve, the myelin has been damaged in the exposed fiber, which will affect the signals being sent to the brain. MS is a horrible autoimmune disease that anyone can get. There is no one thing you can do to avoid it, and there is no cure for it. The symptoms vary from person to person. According to Annette Rizito, who has over 20 years in the field of studying MS at Harvard Health, she states that early symptoms consist of vision problems, muscle weakness, muscle stiffness, painful muscle spasms, tingling, numbness, and the pain in the arms, legs, trunk, face clumsiness, balance problems, bladder control problems, and dizziness. In simple words, MS slowly shuts down your body's mechanisms, and there is no reverse. MS has been a sensitive subject for me for almost as long as I can remember, but one I also feel should be talked about more. This is Russ Heater, grandfather, coach, fisherman, hard worker, husband, and best friend. When I was 11 years old, my grandfather passed away from MS. These are mostly pictures of him towards the end of his life, besides a few when he needed 24-hour care. He was unable to do anything on his own, reposition himself, eat, drink, shower, put on the TV, get dressed. He was completely reliant on either his wife, daughter, son-in-law, or home health worker who would come in while they were gone. He was someone, if you knew him, he would never have been forgotten. He coached girls' college ice hockey, high school field hockey, and in his younger years was always a healthy guy. He had a strong passion for women's sports and was always my inspiration behind why I enjoyed sports so much, but most importantly, why I did track growing up. He never failed to reach out to me before every meet to talk to me and wish me good luck. When he passed away, I ended up quitting, because without him, I had lost all motivation. The following year, I started field hockey, which was his favorite sport, which is a quite controversial statement. But it was my new way of carrying him with me no matter where I went. I thought about many different possible outcomes for my capstone. The biggest outcome I personally wanted was to spread awareness and educate people about MS, so that these individuals do not have to feel like a burden or a special person people do not understand. According to both Amy LaCroix, who is a therapist here at our school, and Michelle Heater, who is Russ's wife and a doctor in Onondaga, New York, people who have this illness require special attention and can see themselves as a burden or a complication. I believe, along with what I would assume many of you also believe, that no person should feel a burden or embarrassed by a life-altering illness that they have no control over, which is why I think it is so important to educate people on MS. For my outcome, I will be giving a chapel talk in the second semester. I will be giving a 5-minute version of my capstone. I will present both to the 9th graders and to Fuller Hall. I plan on shortening my capstone down, but keeping my connection and my most compelling pieces of evidence, showing that this illness truly rearranges your life. I'll put a plug in for anyone who may feel called to donate to the cause. Originally, I had planned to host a drive in the second semester, but ultimately decided that I'd be tapping too much of the community's resources. With some modifications, I have found a way to meet my goal of spreading awareness in a way where I am not asking too much from the community. Here are some examples of ways that people could help if they felt called to, and I will revisit the slide later to give more information on the equipment. As I stated before, according to Annette Rizito, who has over 20 years in the field of studying MS at Harvard Health, she states that early symptoms consist of vision problems, muscle weakness, muscle stiffness, painful muscle spasms, tingling, numbness, pain in the arms, legs, trunk, face clumsiness, balance problems, bladder control issues, and dizziness. These are just a few of the symptoms you can experience as an individual with MS, but the male and female bodies respond differently to this illness, along with symptoms varying. There are 3 different types of MS. These 3 different types consist of relapse, secondary, and primary. Relapse, which is this one, is the most common form of MS. The relapse can have weeks, days, and even months between episodes. During these episodes, your old symptoms will appear along with new ones. relapses are caused by inflammation in the central nervous system. They can be mild enough or severe enough to interfere with your ability to function. According to the National MS Society, Tim Cotes states that after a relapse episode, you are most likely to lose more abilities. Secondary MS happens to individuals who are originally diagnosed with relapsing MS, yet there are no breaks in the symptoms. Primary MS is a one-time diagnosis. You get no breaks in the symptoms, and they are constantly getting worse. An easy way to understand the 3 different forms of MS is to think of it as a way an individual is describing the illness in their body in particular. Here you can see how the relapsing, there's breaks in the symptoms. With the primary, it's constantly getting worse. And you can see how the secondary, it starts off as relapsing and progresses to just primary. MS is generally more common in females than in males. The female to male ratio is about 3 to 1, but men still make up a significant proportion of MS cases. MS typically begins in young adulthood, with most diagnoses occurring between the ages of 30 and 40 in males. MS is often diagnosed later in men than in females, and male patients tend to have a more aggressive disease with the symptoms. According to Dr. Angie, who has over 12 years in the field of MS, states that the symptoms of MS in males are similar to those in females, including fatigue, muscle weakness, numbness, vision problems, cognitive difficulties. However, men may experience more pronounced mobility impairments as the disease progresses, partly due to the more aggressive nature of MS in males. In simple words, MS with men lose the ability to walk and move their body quicker and on their own. While MS can affect both men and women, it is important to note women are affected more. According to the National Institute of MS, MS is about 3 times more common in women than in men. The reason why MS differs for genders is still unknown, but researchers believe hormonal and genetic factors may play a role. Women typically experience their first symptoms of MS in their childbearing years, usually between the ages of 20 and 40, and this can have significant implications for their diagnosis and treatment. According to Dr. Steffine, who has many years of study with MS, women experience more frequent relapses in the relapsing form, whereas men accumulate disability faster, reach disability milestones more rapidly, and show poor recovery after the initial disease relapse. So men typically get less functional faster, whereas women deal with more frequent episodes of relapse with stronger symptoms. Pregnancy also plays a big role in women who have MS. For many women with MS, pregnancy affects their symptoms by improving them. So the 9 months women are carrying a child, they get a mini vacation from their symptoms. Many women experience fewer relapses during pregnancy, especially in the 2nd and 3rd trimester. When levels of hormone progesterone rise, this hormone has a protective effect on the immune system, which may reduce inflammation and the frequency of relapses. Although pregnancy comes with a few breaks in MS symptoms, the months after birth are crucial. During the postpartum period, there is increased risk of relapse. The rapid hormonal shifts, particularly the drop in progesterone after delivery, this tends to trigger the inflammation and the immune system activity. It is very common for women to have bad episodes of relapse after birth. To sum up, while pregnancy itself can bring a temporary improvement in symptoms for some women, the postpartum period can bring an increased risk of relapse. There are hundreds of factors to make MS different for everyone. Since there is no single test that can definitely diagnose MS, and there is no one reason why people get this illness, the process typically involves many steps. Getting diagnosed can sometimes be a long process. Doctors can perform both blood tests, imaging, such as an MRI. According to the National Institute of Neurological Disorders and Stroke, in order to be diagnosed, you must have had 2 attacks at least 1 month apart. They describe an attack as when any MS symptom shows up suddenly or when any MS symptom gets worse for at least a 24-hour period. When imaging is taken, you must have had more than one area of damage to the central nervous system. This damage must have occurred at more than one time and not have been caused by any other disease. Since there is no single test that can definitely diagnose MS, the process typically involves many steps. According to Carrie Hirsch, who specializes in MS practices at Cleveland Clinical, to this day, there are 7 commonly used FDA-approved drugs to treat MS. As I have stated before, there is no cure for MS. Yet there are medications you can use that lessen the symptoms. Multiple sclerosis drugs are primarily disease-modifying therapies, also known as DMTs, that target the underlying mechanisms of the disease by attacking the autoimmune and inflammation, while aiming to slow progression, reduce relapse, and prevent long-term disability. The treatment for multiple sclerosis has changed dramatically over the past few decades. With the approval of these 7 FDA-approved drugs, people with MS have better options than ever to manage their condition, live full, active lives. You can receive this medication orally, injected, or infused. Now, I would like to go more in depth about my final outcome and why I chose it. As I stated earlier in my presentation, I had originally planned on hosting a drive for the items to help people who live with MS make their daily lives a little easier. And up on the screen here, I have some examples of those items. I talked with Mr. Ryan, and he told me how to go about a drive. Later on that evening, when I was talking with my parents, I came to the realization that I was not the only capstone who was going to host a drive, nor was I the only drive that was going to be held throughout the school year, or the school has their own drives planned. I felt like if I was to host a drive, I would be tapping too much of the community's resources, and I did not want people to feel obligated to donate to a cause maybe they did not believe in or did not have the resources to donate to. For this drive, everything would have to be brand new, which also added some limitations to wanting to host a drive. My main goal for this project was to spread awareness, so I resorted to a chapel talk, because where else would I be able to talk to over 1,000 people about this cause? In this chapel talk, I'll be saying that if anyone would like to donate to this cause, then they are more than welcome to reach out to me. Now, these items I have up on the slide all have a special purpose. The cushions are used to position the body in certain positions and rearrange their positions to avoid pressure wounds for individuals who cannot move on their own. Pressure wounds can lead to severe infections, tissue damage, and complications, and potentially resulting in long-term disability. They can be very dangerous if not treated correctly, and people who are unable to move on their own are at high risk to get pressure wounds. The canes, here you can see that they all have different feet which all provide different levels of support. The socks give people extra grip when walking on slippery surfaces to help prevent them from falling. And if you've ever been to the hospital, you've seen these socks. The wheelchair and walker are both very commonly needed items once the disease progresses to the point of impairing the individual's mobility. There is also the option of a cash donation, which can be used to buy these items and to donate them to underprivileged individuals who are located in the Northeast Kingdom. Thank you for taking the time today to listen to me talk about a topic I hold near to my heart. Sources are available upon request. Are there any questions?
Grace, thank you for educating us about MS. I really learned a lot from your presentation. And one follow-up question I have is just, I think you mentioned that in men, it's often diagnosed between the age of 30 and 40. I wonder if that's true for women. I wonder if it's ever diagnosed earlier and how long people tend to live with MS.
So with men, they are usually diagnosed later on in life, more between ages of 30 and 40, and it's easier to catch it in women earlier in life. So it's only like 10 years different. They can get diagnosed 20 to 40, and of course later than that. If it depends on when you are diagnosed, if that will have an effect on your life expectancy, but it tends to shorten people's lives by, on average, 7 years.
In talking about awareness, are there any ways you'd like to see MS represented on a wider brand in like media or on?
MS has been an upcoming thing that people have been learning to be more aware about, and there are definitely social media, and there's organizations and walks and fundraisers. And I think more in rural areas like where we are now, it's just not as prevalent, but yeah.
So, how does someone contract MS? Is it just a genetic thing, or are there any other circumstances that could lead to someone getting it?
It's actually not a genetic thing at all. Sometimes genetics can play a small role, like, but it's not, you're not definitely going to get it if your biological parent has it. It's a small percentage, but the reason why people get MS is still a mystery. A lot of it does have to do with our like the way we live now, the food that we consume, and just as the world is changing, MS is becoming more a common thing people develop and also the further you live from the equator also plays a significant role.
So Grace, that brings some things to mind. First, talk to us a little bit more about your research on closer to the equator more or farther of the equator more?
So vitamin D has a large play in people with MS, and also it has a large play with your immune system. And people who get MS, usually their immune system is weaker, and so with that vitamin D not being able to get it as much, like people that are living down south, I learned a lot that those people are much less likely to get MS than people who are living up in Vermont and we're further from the equator, not getting vitamin D those 12 months, maybe only 5 months out of the year.
My next question is maybe something to think about for your presentation, and that is, talk to us a little bit about the progression of the disease, the demyelinization process, and what that does to the body.
Mm-hmm. So with the progression of the disease, you start off with more weaker symptoms, maybe just a numb arm or I don't know, but the more that your nerves are getting damaged and the more that myelin is getting damaged on the nerve endings, the more it's going to affect your mobility. And mobility plays a really big role with MS progression, and people, especially men, tend to lose mobility quicker, and so it comes to a point where your nerves aren't able to send those messages to the brain that you need to pick up your arm, you need to move your leg forward, and that definitely is an overview of the progression.
I can't remember I think you mentioned this briefly, but are there cognitive effects as well?
Yeah, so it does affect the way that you think and just your cognitive abilities. It plays a role in the maturity of your intellectual abilities. It kind of decreases it.